you. And so I will be talking about composite hydrogels, and more specifically about composite polysaccharide hydrogels for the delivery of hydrophobic drugs. The motivation for this study started several years ago when we asked ourselves, can we use hydrogels to deliver hydrophobic drugs? Hydrogels have many advantages as drug delivery vehicles, are biocompatible usually. They can be tuned to deliver different release patterns. Many hydrogels are injectable. Some of them are environmentally sensitive, for example, pH sensitive or temperature sensitivity. They can be used to encapsulate hydrophilic molecules such as protein and DNA, and many people consider them to be very good candidates for oral and mucosal drug delivery. On the downside, hydrogels contain mostly water, so obviously they cannot deliver a hydrophobic drug very efficiently, and we all heard a lot in the last few days about the importance of hydrophobic molecules. One way that we can use to deliver hydrophobic molecules are microemulsions. Microemulsions are several types of microemulsions. They are all dispersion, thermodynamically stable dispersion of water and oil that, due to the oil phase, can solubilize hydrophobic molecules. There are many fundamental studies in the literature dealing with the properties of microemulsions, and also quite a few studies showing that microemulsions can be used for transdermal delivery of hydrophobic molecules. Of course, microemulsions cannot be used to sustain the release of drugs, since once you administer them orally or otherwise, they experience immediate dilution and there is no effect of sustained release. So the idea was to use oil and water microemulsions and encapsulate them inside a hydrogel to obtain a composite hydrogel, where the drug loading is inside the oil droplets, and the matrix, the network, the cross-linked network of the hydrogel can be used as a solid support that can be delivered orally or through the mucosa and sustain the release of drug. So this may sound as a very simple and straightforward approach. However, when we try to do it in the lab or accomplish this task in the lab, we found that it is quite challenging. Starting with the microemulsion itself, as I said, there are many articles, many publications dealing with microemulsions in the literature, but most components used are not biocompatible. And of course, we wanted to use only biocompatible ingredients. So many articles use hydrocarbon oils, which are not acceptable. Most of the surfactants are toxic, at least to a certain extent, so this is not easy to replace them. Also, all formulations are empirical. It's very hard to predict which component can be replaced with another one to obtain a stable microemulsion. Quite often there is the use of co-surfactants, such as long-chain alcohols, which are, again, not biocompatible, or short-chain alcohols that escape from the microemulsion upon dilution. Even when you crossed all these barriers, once you incorporate the drug, quite often you experience phase separation. Going further to next step to include the microemulsion inside the polymer, one quite often sees that there are not many studies dealing with combinations of polymer and microemulsions, which is for a good reason, because the polymer interacts with the microemulsion and the microemulsion phase separates. So this was quite a challenge, and I was lucky enough to have a talented and hardworking PhD student that took this challenge and managed to find a very, I don't have a pointer, and managed to find a very stable combination of ingredients that gave a stable microemulsion. It is based on, maybe this, never mind. It is based on two thank you. There are many pointers and many pointers and only none for the speaker. Okay, thank you. So this combination is this microemulsion is based on two non-ionic surfactants, Twin 80 and Span 20, which are non-toxic, and this is the oil IPM. And she used several molecules as a model, starting with Ketoprofen. So she formulated the microemulsion, and this is a cryo-TEM image showing that indeed we have a stable microemulsion. The black dot here are the oil droplets, and with DLS, dynamic light scattering, she characterized the size of the droplets. As you can see, the droplets are about 10 nanometers in size. They vary a little bit with the oil content, and also when you incorporate the drug inside, there is slight variation in the droplet size, but overall the size is about 10 nanometer. And more precise characterization using small angle X-ray scattering. I will not get into the details, but I will say that this technique allows us to precisely characterize the structure of the microemulsion, and using this technique and mathematical modeling, we verified that the structure is oil droplet covered with a shell of the non-ionic surfactants, and the thickness of the shell is about 6 nanometers, and also we could locate the drug within the shell of the surfactant. Moving on to the next step, we had to choose our polymer. So we started with alginate. Alginate is a polysaccharide. It's actually a block polymer of hyaluronic acid and manuronic acid. It is driven from brown algae, so it is hydrophilic, water-soluble, biocompatible, known to be mucoadhesive, and one of the nicest features of alginate that it is you can cross-link it in the presence of calcium ions. So this is a physical gelation, no heat release, no toxic compounds, cold setting of the alginate. So this is a very nice feature, and we started to work with the alginate. You can see here a picture of the alginate gels which are clear. Once you add the drug, the Ketoprofen, it is hydrophobic, so it precipitates and forms crystals, so the gel is not clear anymore. But if you prepare the composite hydrogels, the drug is dissolved inside the oil droplets, and you have clear hydrogels. And again, using small angle X-ray scattering, we verified that the oil droplets retain their shape and size while entrapped inside the hydrogel. Going forward to release profiles, these were done in distilled water. So these are the release profiles of the Ketoprofen. Again, I don't know why it is. Oh, I see. So these are the release profile in water, and this chart quantifies the release in terms of time to 20% release and time to 50% release. And what you see here is that the release time depends on the calcium concentration, which makes sense since this is a cross-linker. So if you increase the calcium concentration, you have a denser network and slower release. But overall, the time to 50% release is less than 4 hours. This chart shows similar results, now a dependence on the alginate concentration at 2 different calcium concentrations. So again, if you increase the alginate concentration, you have slower release due to a denser network, but the overall release time is quite fast. All this data is hinting into a simple diffusion mechanism of the droplets out of the hydrogel. Since the release rate really depends on the properties of the hydrogel itself. Now, additional confirmation to this mechanism of simple diffusion of the droplets out carrying the drug is shown in this slide. You can see a lot of data here. For example, here we compare different type of microemulsions, slight variation between the formulations. Different oil concentrations or surfactant concentration, but you see the release patterns are quite similar. This chart shows microemulsion loaded with progesterone in 3 different formulations. Again, very similar release patterns. 2 different molecules, progesterone and vitamin D, compared to the microemulsion without the drug. Again, similar release patterns, and here we took a hydrophobic molecule, Nile red, at several different concentrations. They all show the same release pattern. So you can vary the release pattern by changing the composition of the hydrogel, but the type of the molecule embedded inside the microemulsion does not vary the release pattern. So this is kind of a generic platform. You can adjust it once and then put in whatever you want, and the release pattern will be identical. Last thing that we did with this system is try to dry it up, because it's quite hard to keep wet systems. So we tried several types of drying schemes, freeze drying or solvent switching and so on. You can see that the drying and rehydration affects the release pattern, but still, again, small angle X-ray scattering, we showed that drying and rehydration reconstructs the droplets, and the drug is still inside the droplets after this process. So this is this is shown here. You get clear hydrogels after the rehydration. So there are several nice features with the alginate composite hydrogels, but there are still some severe limitations. First, the release is quite fast. It is completed within a few hours. And one other thing is that alginate hydrogels are not durable in physiological conditions. If you put them even in a PBS buffer, within 2 hours or so, they disintegrate completely. So we wanted a more durable hydrogels that can withstand physiological condition. And at the same time, we wanted longer release time. So we wanted to continue this work by applying or by using positively charged hydrogels. And furthermore, we wanted to prepare anionic microemulsions. So we have to have electrostatic interactions and longer release time. But in order not to change two parameters at once, we started this work with positively charged hydrogels and the same non-ionic microemulsions that I have shown so far. So the choice was chitosan hydrogels, which are positively charged. Again, chitosan is a polysaccharide, very well known, non-toxic, biocompatible, biodegradable, has other beneficial properties such as antibacterial properties, and we wanted to work with this one. Many people cross-link chitosan with glutaraldehyde, which is kind of toxic, so we preferred to do the cross-linking. It is a covalent cross-linking, but we chose to do this with guanipine, which is a natural molecule and known to be non-toxic. We knew from the literature that this reaction is pH dependent, so you have a different reaction if you do it at acidic pH or basic pH, but we really couldn't predict the extent of influence of small changes in the pH on the properties of the hydrogel. This was not reported before. So this took us to another study where we very carefully checked the influence of the cross-linking scheme on the properties of the hydrogels. I will not show all the data here, just to demonstrate. These hydrogels were all cross-linked for 20 hours at different pH values. You see the steps are small. This is pH 4, this is pH 4.5, and so on. And after the cross-linking was completed, the hydrogels were taken out from the mold and swollen in water. So the swelling conditions are identical for all hydrogels, and you can see the huge difference in the swelling of the hydrogels, as well as other properties such as mechanical properties and so on. The action is also very slow, so it matters a lot. You never reach equilibrium, so it matters how long you cross-link it. If you cross-link it for 90 hours, for example, you still see differences in the swelling, but to a lesser extent. So we had to be very careful about selecting the properties, the conditions on the one hand. On the other hand, you can simply change a little bit the pH, and using the same chemical composition of the hydrogel have a variety of network properties. So here we chose for these studies two types of hydrogels. One was cross-linked at pH 4, so it is lightly cross-linked, and the other was cross-linked at pH 5.5, so it is a more dense network. And for the sake of comparison with the alginate, we performed, again, release experiments in water. So these are microemulsions containing Nile red, and these are microemulsions containing curcumin. And there are several observations that can be seen from this slide. First, you can see here that the release rates are much longer, even with non-ionic emulsions. So the release here is over 60 hours or so. Second, you can see differences in the release pattern between different molecules inside the microemulsion. So this is also different than alginate. And finally, and maybe most surprising, the release from the lightly cross-linked hydrogels is slower. So this is not what we expected. We expected to have slower release from the highly cross-linked hydrogels. Now, with chitosan, we can work in PBS. So this is a release in PBS buffer, which is faster, but still over 10 hours, which is really nice. Again, differences in the release pattern for different molecules. And this hints to a more complicated mechanism where there are interactions, not only diffusion, simple diffusion of the droplets outside of the hydrogel, but also some interactions between the droplets and the network. And indeed, we were able to confirm this, as I will show shortly, because I still have time, right? Because this is a more complicated mechanism. We wanted to see if it also affects other properties of the hydrogels. So this is, for example, the swelling of the hydrogels. You can see here that the swelling of the hydrogel without microemulsion is different than that of the hydrogel with the microemulsion not containing drug, and again, different from that of the hydrogel with microemulsion composite hydrogels with drug. And same goes for other gels cross-linked at different conditions. Another example for the influence of the droplet on the hydrogel on the network is the rate of the swelling. This is percent swelling per hour, and again you can see differences between the hydrogel and the hydrogel that contains the microemulsion, the composite hydrogel. So as I mentioned, this hints to a more complicated mechanism and to interactions between the droplets and the network, and we were able to confirm this with FTIR, and we'll not get into the details, but the chitosan has many amino groups, so you can, using FTIR, you can see that there are many hydrogen bonds involved between the head groups of the surfactants and the network, which causes a more complicated mechanism. So I hope that I was able to demonstrate that composite hydrogels we can prepare composite hydrogels, we can solubilize the drug within them without any visible precipitation, while preserving the structure of the droplets, and we believe that this system has a potential for delivery of hydrophobic drug using hydrogels. So this is my research group. This is Elinor, who did the work on the alginate hydrogel, and this is Karen Delmar, who followed her, a master's student that did the work on the chitosan hydrogels. And just a few pictures for from the hometown of my university, and thank you for your attention.
Thank you, Dr. Havazelet. She has very nicely explained about the hydrogel and the microemulsions, including this cross-linking, droplets, and many, many complicated phenomena. So I hope one or two questions from this audience. Any question? I hope she has explained very nicely. Really, it's a very interesting topic, and right nowadays we are using the chitosan nanoparticles, using this hydrogel and this ionic gelation method with this calcium ions and alginates, and how long we can cross-link and how much we can improve the properties. That's a very interesting area, and people are working in the different institutes. Thank you very much. It's my pleasure to give a certificate.